tell me your name and introduce yourself for the camera, for the folks here at home.
My name is Dan Quattro, and I'm a practicing chiropractor in Webster, New York.
How long have you been practicing?
I started practice with my father in 1988. We started on the east side of the city near Culver and Clinton, Empire Boulevard, in that area.
And how long has your father been doing it before?
My father started practicing, he practiced for 57 years. He passed away 2 years ago. So he practiced for 57 years. I don't remember exactly what year he started practicing, but
Your whole childhood?
my whole childhood. In fact, that's really what motivated me to become a chiropractor. Was that we lived in a home office. I grew up in the same home where my dad practiced chiropractic. So I watched him work. I saw what a good healthcare provider he was. I saw how much his patients appreciated what they were doing for him, and ever since I can remember, I didn't want to be anything else but a chiropractor. So I went to chiropractic college after I went to Niagara University and followed in his footsteps.
So what chiropractic college did you go to?
I went to New York Chiropractic College. At the time, it was on Long Island.
Okay.
Shortly after I graduated, it bought the Eisenhower campus in Seneca Falls and relocated to Seneca Falls. But when I went, it was still in Long Island.
Was there a reason behind your choice to go to that school, or was it just the only possibility in the area?
My dad went to Logan College of Chiropractic in St. Louis, Missouri. In fact, his brother Richard went there as well. My dad was there 6 months before his brother was, and they both practiced chiropractic here in the Rochester area. So, I naturally wanted to go to St. Louis to chiropractic college, but the chiropractor that motivated my father to join the profession, his name was Malin Blake. He actually treated my dad's mother, my grandmother, after she suffered back pain for over a year, debilitating back pain. And my dad at the time was motivated to pursue chiropractic as a profession. And he at the time, Dr. Blake, was on the board of New York Chiropractic College. So he suggested that I go to New York Chiropractic College, which was closer to home, and he knew that it was going to be a quality education and a good school.
So how did you make the transition from, let me rephrase that, did you always work with your father from day one?
Yeah, I started practicing with my dad in 1988. We practiced in the same location on Culver Road for up until the year 2000, and then the two of us kind of outgrew the office. So I struck out on my own for a little while. I moved out into a larger office in Webster, in Spring Pines Office Park, and I practiced there. We practiced in two basic locations for a couple of years before he sold the office on Culver Road and moved his practice in with mine.
So when you were on your own, was it kind of a satellite office still under the same name, or did you completely?
No, it was a satellite office. That's how we described it. It was kind of funny that we called it a satellite office because it was so much bigger. Our practice really moved from the east side of the city towards the eastern suburbs. So our practice base moved from like the Culver, Cedarwood, East High neighborhood, the neighborhood around Bausch and Lomb, towards Penfield and Webster and Fairport. The way that people migrated out of the city into the eastern suburbs. So it just made sense for us as both of our practices grew, or my practice grew, that we would outgrow our location and move into a larger facility on the east side of the city, in the eastern suburbs.
Now, how did the move affect your patient base? Did you have a lot of patients that followed you to the new location, the new area of town, or did you kind of see a transition there?
It wasn't a huge geographical change. It was maybe just 5 miles difference down Empire Boulevard. So my patients followed me, and my dad's patients subsequently followed him. But it also gave us the opportunity to grow the practice because we were closer to our patient base in Penfield and in Webster. So it was more accessible to our patients in a sense. So the practice grew. We also had a 3,000 square foot office, so there was more room for us to practice together, there was more parking. And the other thing that it did was we were in a professional office park setting, and as chiropractic has moved more towards the mainstream, it sounds kind of funny, but we were in an office park with other physicians and physical therapists and ophthalmologists and a big OBGYN practice. So as we've integrated our practice into the mainstream, it seemed like a more natural progression for us to be in a more professional office park.
You mentioned moving into an office park legitimize your business or legitimize your practice a little bit more. Have you noticed a change in how people perceive chiropractors since you started practicing until now? Is it more accepted, or has there been any sort of a shift?
Yeah, the shift in acceptance towards chiropractic has been dramatic in the time that I've been in practice since 1988. But particularly since my father began practice, in the 1950s, it wasn't legal for chiropractors to practice. So we were, in fact, arrested for practicing medicine without a license. But during my tenure as president of the New York State Chiropractic Association, we really have worked at mainstreaming chiropractic. Chiropractic has been, an important part of the way that patients with back and neck pain managed their back and neck pain. There was a time when it was unheard of that a chiropractor would receive a referral from a physician or a specialist like a neurosurgeon or an orthopedist. But now that represents, maybe 50% of the new patients that come to our office. So there has been a dramatic shift, not just in the perception of chiropractic, but in the way that we practice chiropractic. We're definitely more mainstream. We're not as alternative, I guess, for lack of better characterization, than we used to be.
So what do you think has changed that over, say, the last 10, 15 years? What's made it more mainstream as far as how you practice?
I think that what's changed it the most in this community is that we have, as a group of chiropractors, made sure that we have integrated into the mainstream. We've reached out to the medical community, to the hospital community, to the insurance community, to make sure that they understood what we were doing as a profession and as professionals, while at the same time understanding what they needed from us as a profession. So it's been a symbiotic relationship. And not just that, there's been a rise in the use of alternative healthcare across the nation over the past, decade and a half. So that put chiropractic in the position of being able to mainstream itself. While we're still considered alternative in a sense, we're less alternative maybe than acupuncture or massage therapy or aromatherapy.
You mentioned massage therapy. You currently have a massage therapist that works as part of your practice?
There is a massage therapist that works in our practice. His name is Joe Darby. He's been an important part of our practice, particularly for patients like athletes or patients who suffer from chronic or recurrent lower back or neck pain. He's been able to intervene with his services and really help people progress more rapidly.
Do you see that as kind of a part of your growth and maybe something that you continue to grow in that department, or?
I think it's been an important part of our practice. I think that patients have to be very careful about how they select a massage therapist. I think that there are a lot of massage therapists out there that still practice on the fringes of the profession that might be a little bit more strange or odd, I guess, in the way that they approach, or mystical in the way they approach massage therapy. When you're looking for a massage therapist, you want to find a massage therapist that does good deep tissue work and really understands the biomechanics of the patient and their muscular structure.
How have you, since you started practicing with your father and now you've progressed into moving on your own, how have you changed in the way you practice as far as maybe techniques or different things that you use?
I think that the way that treating patients with back pain has changed dramatically over the last 20 years. It used to be that you would suggest bed rest for patients with back pain and you would tell them to avoid activity, but it's actually the exact opposite now. You want to take a patient with back pain and you want to help them to understand their pain. You want to help them to understand that they need to move, and you want to teach them how to move properly. You want to teach them behaviors that are going to help them minimize recurrence of their back pain. So that's really what's changed a lot in the management of patients with recurrent back pain, or even acute back pain for that matter. What we understand about back pain now is if someone has an episode of acute back pain, if they hurt their back for the very first time, we want to focus on managing that patient, teaching them how they need to manage their pain at home, as well as teach them about the biomechanics of their back so that they can avoid future episodes of back pain. the vast majority of people with back pain suffer from recurrent back pain, where they'll suffer, subclinical or less acute self-limiting episodes of back pain over a course of years, where they will have hurt their back and the pain isn't that bad so that it affects their activities of daily living, and they get better on their own. Maybe they take some Advil or some Tylenol and they get better. But now their episodes of back pain are lasting longer and they're more severe, and they're starting to change the way that they behave during the day or not do the things that they like to do. So a big part of what I do is I help them to understand that they need to not fear behavior, not to avoid things that they like to do, but to help them to understand if they begin certain movements or they condition themselves and they get physically active, that this will help them be able to regain those things in their life that they have stopped doing because of their back pain.
So would you say patient education is more important now than ever, as far as educating them on the anatomy and how their activity affects their lifestyle?
Absolutely it is. I think that educating the patient is 90% of what I do. You have to reassure a patient that their pain isn't catastrophic and they're not going to suffer debilitating injury from it. You have to encourage them that even though sometimes movement is painful, that they need to do it. You have to get people up and moving as soon as possible. You have to get them doing activities that they like to do. So you have to get to know your patients. You have to understand what they like to do. There's no point in encouraging someone to do water-based exercises, for instance, if they don't like the water. So you have to get to know your patients and understand what they like to do and what activities turn them on, and you have to encourage them to do it. So much of what I do is patient education.
What do you like most about what you do?
We take care of a lot of people who are very active. Athletes get injured. And those injuries include back pain. So we manage those people, But what I really like the most is when someone comes in that isn't particularly active. And maybe they have some obesity issues, but now they have a history of back pain. Or maybe they had a history of back pain for a long time. What I like most, or what's most satisfying to me, is when I can talk to that patient about what kind of activity they like or they used to like. And I can motivate them to own their pain and to get active, to participate in some sort of activity, whether it's just walking a few times a week or whether it's more active exercise like a water-based exercise or a yoga class or going to the gym and getting on the treadmill or riding a bike. And then watching that patient transform to somebody who is sedentary and maybe a little overweight and suffering from recurrent back issues to someone who has back pain less often but is more physically fit and is able to enjoy their life more and is just basically more healthy in general. I think that that's what I like doing most, is I like taking that patient that might be deconditioned or demotivated and changing them around by helping them to understand what's going on with their health, what's going on with their back, and encouraging them to be active. When I started this whole process for myself 10 years ago, I was 80 pounds heavier. Now I'm 80 pounds lighter. I'm active on my skis and on my bike. I ride my bike avidly. And that's made a tremendous difference, not just in how I feel, but in my health care in general. I don't need to be on cholesterol medication. I don't need to be on medication for gastric reflux. And my back feels better and my neck feels better. So when I could take a patient like that, like I used to be, and I can motivate them to get healthy, to adopt healthy habits in their life, that's what most satisfies me. Treating their back pain is easy in that regard. Their back pain's going to go away. Maybe it will bother them periodically, but that'll be a healthier, happier patient. They'll be a more productive member of their community. They'll be a better mother and father, because they feel better and because they're healthier. That's really what charges me up about what I do.
What do you do in the community outside of chiropractic to, keep yourself motivated, draw attention to your practice, or whatever it might be?
Well, like I said, I'm active with biking, so I'm active in the biking community. But the one other big thing that I've done in my life was when I was president of the New York State Chiropractic Association, I got to know all the local political leadership because basically we advocated for our profession politically. And in 2004, after the death of my county legislator, they asked me to interview for the job as county legislator from the 15th district. And after initially declining because I never really aspired to be involved politically, I said yes. I went down and interviewed, and 2 weeks later, I was a county legislator. So I've been active in my community politically. I don't think of myself so much like a politician because I'll never do it full time, but it really has gotten me involved with my community. I know how my town works, how Penfield works inside and out, how my county works inside and out. And that's afforded me the opportunity to network with some people in the community that are active in healthcare as well, whether it's been at hospital systems, the elite decision makers of healthcare in the community, and of business, and of politics. So they see that I'm a chiropractor and I'm not a weirdo, And I think that that's how chiropractic has been best mainstreamed, by chiropractors participating in their community like that.
As part of overcoming the stigmatism that comes along with chiropractics, how do you go about making your patient feel more comfortable, or maybe some of the fears they might have about, you're going to crack my back, you're going to crack my neck? How do you go about that?
I think that the most important thing that we do with our patients is establish a relationship with them as soon as I sit down in the exam room with them. I listen to what they have to say. I listen to their story. I ask them questions about their life. I do a complete examination on them so that I can make a responsible diagnosis, an accurate diagnosis. And then from there, we put together a treatment plan. And if I don't think that I can manage a patient's back pain, then I will refer them to the appropriate specialist. I have a relationship with neurosurgeons in town, and orthopedists, and pain management specialists. So I really act as their primary spine care provider when they come into the office. And that's really how I view myself, as a primary care provider for spinal disorders. And that's how I integrate into the healthcare community. So I work with the patient's primary care provider, their medical doctor. If need be, I send them for x-rays or advanced imaging like MRI or CT. Or I'll refer them for pain management, or I'll refer them to neurosurgery. But more often than not, that's not necessary. We can, with conservative interventions and exercise programs, treat a patient so that they don't have to go to the next level, so that they can avoid having spine surgery, which can be debilitating. Spinal fusion fails 70% of the time. So if a patient comes to me with a spinal fusion, it's almost too late to be able to help them. Then you can help manage their pain, but they'll always retain some level of pain or disability. So we want to avoid that. And I think that patients are reassured that we work collaboratively with other healthcare professionals in town. And that's where they find their comfort, in reassuring them that they're going to be okay, and that they're in good hands, and that we're going to be able to manage their spine pain.
So you want to be, if somebody has back pain, you don't want to just be seen as a chiropractor or one solution. You want to be seen as somebody who can take them through the whole process from start to finish, whether it's in-house or referral, and then manage their recovery throughout the...
I think that the biggest change for me as a chiropractor, or maybe for my profession of chiropractic, is that now that's what we do. We're so well integrated into the healthcare system that we can be effective managers of people's spine pain. So when a patient comes to me, I know that if they need a more advanced intervention, I can get on the phone with a neurosurgeon and have that patient evaluated in short order. I know that I am capable of diagnosing a patient accurately enough so that I'll know where to send them. And I also know when I can conservatively treat a patient and educate a patient so that they don't have to resort to these other interventions. And I think that that's really the biggest change in the profession since my father began practicing and today, is that we're so well integrated into the system that we can manage spine pain very effectively.
How is your education continued, and how important do you view continuing your education from when you started practicing until now and then into the future?
I think it's critical that that we continue to educate ourselves. I mean, healthcare is changing dramatically, not just for chiropractic, but for medicine and medical interventions and imaging. So it's important for the chiropractor, or any provider for that matter, to participate in continuing education. We have a requirement to do that, but at our office we make sure that we are as up to date as possible in pursuing continuing education opportunities. So, 40, 60, 80, 100 hours a year of classroom time, seminar time is not atypical. And for me, it's been important to do that in a multidisciplinary environment. So the educational opportunities that I pursue would include medical doctors and physical therapists and surgeons. We all get in the same room together and we educate ourselves together.
So is it a pretty tight-knit community then, the chiropractic community? How well do you work with other people in the region, in the state?
I think Rochester is a long history of chiropractors that have been activists. My father was involved in the New York State Chiropractic Association. I eventually became president of the New York State Chiropractic Association. This community has always worked well with insurers and with hospital systems and physicians as far as the chiropractic profession goes. So, I think that we do a really good job, or have historically in the Rochester area, of integrating this profession into the mainstream.
So where do you see your practice going in the next 5 years, 10 years?
Well, I think that what I would like to see happen in my practice is for it to become more multidisciplinary. I would like to see more people from the community that are more confident in our ability to manage their spine pain. What I like to do best is manage people's back and neck pain and headaches. I like to be able to work collaboratively with other healthcare providers and making sure that these patients get better as quickly and as conservatively as possible. The less medication that they have to take, the fewer surgeries they have to endure, the better for them. Those interventions have their shortcomings. And I think that the more conservative you are when you're approaching back and neck pain in particular, the better. So I'd like to see our practice grow in that regard. That's what I like to do. I like to treat patients with back and neck pain. And I think that that's most satisfying. That's what satisfied me the most, and I just like to do a lot more of that.